Transcranial Magnetic Stimulation, or TMS, is an FDA-approved treatment for the treatment of severe depression, meaning depression that hasn't responded to medicines. If you're somebody who has been on medicines and feel like you keep rotating off and on and off and on, then this might be a treatment for you that does not require the use of medications. What it does is we believe that when somebody is severely depressed, their brain doesn't have the ability to make the neurochemicals needed to feel happy. And so a powerful magnet, like you might see in an MRI machine, targets specific parts of the brain to get it like a jump start or a reset to get those neurochemicals flowing again. It does require a time commitment, so patients come in and they are treated every single day for 36 days total. However, the chances of it helping versus another medicine is generally much higher. In patients who've been on 4 or more medications, the chance that the 5th medication is going to cure depression is about 12 to 14%. With transcranial magnetic stimulation, that chance goes, depending on the study you look at, in the high 20s to about 40% chance of cure. For patients to get 50% or more better though, that can happen in up to 80% of patients who try TMS versus 30% who just try medicines. Common side effects of TMS include headache, maybe some tingling or twitching at the site where the magnet crosses into the brain, but you're allowed to drive, you're allowed to go to work, you're allowed to do everything you need to do after the treatment. You do not need to be admitted to a hospital or anything like that. This is an outpatient only procedure, and it is covered by most insurances and is FDA approved. We've had this machine in here for about a month. Here in the clinic, we're treating about 8 patients right now. So I do what's called cortical mapping, where we look and see where on the brain we need to provide you treatment and how strong that treatment needs to be. And then you come in every other day with our TMS technician, who then actually delivers the treatment every day. So this was first FDA approved in 2008, but it's been around for 30 to 40 years, just in different stages of research and development. It was started in England. That's kind of where TMS was invented, you could say, and then has become a widely well-regarded treatment for severe depression. There are newer studies and things coming out showing that it has been helpful in conditions like anxiety or severe PTSD, OCD, smoking cessation, things like that. However, the only FDA-approved treatment right now for our device is depression. That being said, if you have one of those things and it's something you're interested in, then we can talk about using it, with the caveat being your insurance wouldn't pay for it. One common misconception is this is shock therapy, electric shock therapy. It's not. It's magnet as opposed to electricity. And so with electric shock therapy, you usually have to be admitted to a hospital. You have to be sedated. You frequently will lose memory. Everyone's a little bit different. Some people just are sick of being on medicines. They always have side effects. This isn't going to make you gain weight. This isn't going to make you lose your sex drive or anything like that. This is relatively side effect free, and you can potentially not have to take medicines afterwards.
Forever?
It depends. Everyone's a little bit different, but there are lots of people who never have to take medicine again. Some people have to have what can be considered like a booster treatment of TMS every couple of years. But again, that's very patient dependent.